I think that in theory, that makes a great deal of sense. And I'm a researcher, so I've done a lot of look at giving feedback to providers and seeing what happens. Dr. Jones, you don't seem to be doing so well on this particular measure. Or Dr. Smith, you seem to be doing better. And we can discuss why, but the research on what people call this audit and feedback is that it doesn't make much of a difference with providers. So while I think in theory, as a provider, I would hope that, as a physician, I would hope that if someone told me I was doing poorly on something, I would react and change, but we don't have that. We don't see much evidence, and so that actually has led to value-based purchasing. Because if it was as easy as just showing doctors, hospitals, nursing homes that they were doing poorly, then you wouldn't need to do any of this value-based purchasing. You could just show them the data and quality would improve. And it's interesting that value-based purchasing is built on this premise that audit and feedback isn't sufficient. And I don't have a great explanation of why audit and feedback isn't sufficient. It's just that it hasn't really been borne out in the literature.
So Ateev, I would challenge you on that, though, because I think that I agree with you that it's not enough, and that's why you need value-based purchasing. But I would challenge you on the part that it didn't have an influence on the providers when the data is put in front of them. My experience with them is this. To your face, they will tell you, I am the best, I do what I'm going to do, I was trained, I'm not going to change. But then you look at the behavior later, and it does change. But they won't give you the satisfaction of telling you at the time, but it does change.
I guess what I would just say is that we have seen some work that if you publicly report that information, then providers do seem to change. But if you just give it to them privately and say, Art, it's not going so well here, they don't seem to respond. And again, there's a disconnect between what I would think would happen and what actually has happened.
This has become, I think, Francois' life work, focusing on value-based purchasing programs. My sense is
one of my life's work.
Okay. My sense is it's going a lot slower than you would prefer, and so maybe you can jump in here and sort of comment on this debate.
Well, everything goes a lot slower than I'd like. Look, today we're at least at a point where I think the vast majority of physicians and hospitals and hospital leaders recognize that the world has changed. And that taking into consideration appropriate feedback loops is not just a luxury, but it's a necessity. And I'll just give you a quick anecdote from work that we're doing in the field today. Last week we had a call with some orthopedic surgeons who are working hard on a value-based payment program. And we've shown them the data. They believe it. They've looked at their own medical records. They understand it. They understand actually what needs to be done. And the basic comment was all those evidence-based things all those non-evidence-based things that we knew we shouldn't do, we finally have a reason not to do them. So it's the professionalism only works if the incentives that are deployed don't drive you against that professionalism. And unfortunately, the vast majority of payers have driven incentives against professionalism for decades. And they're finally coming to the realization that that might not be a good idea.